Our programme that I'm working on is called the Cancer Medicines Outcome Programme. It's a 3-year Scottish Government funded programme that's a collaboration between NHS Greater Glasgow Clyde and the University of Strathclyde, and we're trying to maximise new data intelligence for cancer medicines and create, ultimately create data to improve that patient-clinician discussion and give sort of a more personalised approach to the medicine choice. So in year one I led in the prostate cancer work stream, and we looked at the use of Abiraterone and Enzalutamide, which are two medicines or systemic anti-cancer medicines for men with metastatic castration-resistant prostate cancer, and we looked at their use prior to docetaxel-based chemotherapy and following docetaxel-based chemotherapy. And as part of our methodology in CMOP, we're looking to look at the use of electronic record linkage, which is combining our chemotherapy prescribing system records with other routinely captured data sets via a secure platform and linking via the patient's unique identifier, and to see if this is a robust and more efficient method for collecting outcomes in cancer medicines. So at BOPA today I am presenting on looking at the trial eligibility of our real-world population in comparison to the clinical trial. When we looked at the use of Abiraterone and Enzalutamide in our patients within Greater Glasgow and Clyde, it was a retrospective analysis. In general, we found our median overall survival was much less than the reported within the pivotal studies. However, there were significant differences in our patient populations. So we wanted to identify if we could use our electronic record linkage methodology to identify patients that would have matched the trial patients, to then sort of bring some context for applicability of our results to the trials. So we managed to identify many, but not all, of the clinical trial eligibility criteria could be identified using electronic record linkage. And when we did this, we found that just under half our patients actually matched or were estimated to match the clinical trial populations. And then we actually looked at the subpopulation who did match the trials and looked at did a sub-analysis of what their survival would be, and we actually found that median overall survival improved, and which is not surprising in that they were more like the trials, and particularly so for the patients that received Abiraterone and Enzalutamide post-docetaxel-based chemotherapy. So hopefully using this electronic record linkage methodology allows us to compare our populations between real world and the clinical trials, and just provides that context of applicability of our trial results.